Hi, buddy, Dr. Daniel. Let's make a statement about using over-the-counter drugs to treat migraine. Well, for years I've been a neurologist and a headache doctor, and I've always encouraged patients, to see a doctor, get a prescription, treat your migraine, and to not use over-the-counter medicines that didn't work as well. But I finally realized through my thick head that it's published that something like 40 to 50% of persons who actually have migraine have never had a diagnosis by a doctor and have never had a prescription for a migraine type drug to treat them. So I guess for folks with migraine, we're going to have to learn how to use over-the-counter drugs. Now, any drug you're going to take, you want to take at onset. And the typical over-the-counter drugs one thinks of are called NICE. It's non-steroidal anti-inflammatory drugs, and those are like Advil, ibuprofen. Those last 4 hours, or it could be acetaminophen, which lasts about 4 hours, or Aleve, which is naproxen. Those guys last about 8 hours. A lot of folks will use Excedrin, which is caffeine and aspirin together. And those are the most common drugs that are used. Again, they're over the counter, and you can just buy them at the drugstore or grocery shop. They will give some relief for headache for some folks, and really that's all they really need if they treat at onset. Now, the side effects of those drugs can be irritable of the stomach, which could aggravate gastric reflux or an ulcer if you have that, or give you kind of a burning feeling. Now, the news is that the Triptans, which are still the best drugs for treatment of migraine, have been released over the counter. And the Triptans came out in 1990. And I'm dictating this in 2023, and they're still the best acute therapy drugs on the market. And I have YouTube videos and blog articles about that if you want to look at it. So if you take a Triptan at the onset of a migraine, something like 60-70% of patients are headache-free within 2 hours. Pretty cool. Side effects of Triptans can be a tight feeling in your chest or neck in through there that can make you feel kind of dizzy or sleepy. The side effects are not that bad. And the drugs that are now over the counter are Imitrex, which is sumatriptan, and then Zomig. Those drugs are all over the counter and available. Those drugs can work really well. The other message should be to all y'all is that migraine patients shouldn't take daily caffeine, because caffeine is a headache medicine. The Mayo Clinic has said the maximum amount of caffeine a day a person should take if you don't even have migraine. If you don't have migraine, you can take up to 400 milligrams of caffeine a day. But if you do have migraine, then that's like a headache drug. And the problem with that is in over-the-counter drugs, Advil, Tylenol, Excedrin, if you take one of those 15 days a month, that can give you medication over your headache. It's also called rebound headache. Or if you take a Triptan 10 days a month, that can give you medication over your headache also. So the general rule always coached by patients with headache was to limit their headache drugs, NSAIDs or caffeine, or even a Triptan to no more than 2 days a week, and you're probably good to go. Now, these folks should also consider doing the migraine lifestyle, which is freedom from stress. Well, who can have that on this earth? But try to decrease stress as much as you can, exercise regularly, attend to their diet, maybe get a cell phone diary for your, so you can look at that later and help you study previous headaches and let you get the trend of what's causing them. And then if you can, you have insurance, you might consider seeing a headache doctor to try to get help. But these are the ideas I have just for treating migraine over the counter. Hope it's helpful to you. I'll see you again on the next talk, and please click like and subscribe down there. Thank you very much.